All right, so medical detox. It's one of those things, right? Like everyone thinks they know what it is, but when you really dig
Oh,
in,
it's a whole other ball game.
yeah,
Way more going on than just, those juice cleanses and fad diets.
exactly. And it's so easy to get those two things mixed up.
Yeah,
But what we're talking about here, medical detox, this is serious stuff, especially for folks battling addiction, like drug or alcohol addiction.
absolutely. We're not talking about hitting a reset button after a big weekend. This is a medically supervised process, designed to help someone safely, and I think this is key, comfortably withdraw from whatever substance they're dependent on.
And that's a big deal because, let's be real, quitting any kind of substance, cold turkey especially, it's rough.
It can be incredibly difficult, even dangerous in some cases. And that's where the whole medically supervised part comes in, reduces those risks, provides that safety net.
Right, so less crash landing, more controlled descent.
Perfect analogy.
So let's get into it. What does a typical medical detox program look like, step by step?
So the research points to a pretty clear process. It all starts with a comprehensive assessment.
Okay, so like a health history kind of thing.
Basically, think of it like a medical detective, right? Gathering clues to tailor the detox to you specifically. What substance, how much, how long, any previous attempts to quit, your overall health, any underlying conditions. They're trying to get the full picture.
So not a one-size-fits-all situation.
Not at all. Every person is unique, and their detox plan should reflect that.
That makes sense. Okay, so they gather all that information, then what?
Then comes stabilization. This is often where medications come into play, to help manage those withdrawal symptoms.
Which I imagine can get pretty rough depending on what you're detoxing from.
Oh, absolutely. We're talking everything from the usual suspects like anxiety, insomnia, those relentless cravings.
Yeah, those are no joke.
No, not at
Yep.
all. But then, in more severe cases, you could see things like seizures, hallucinations, delirium. It can get pretty intense.
That's why that medical supervision is so important, right? To
Yeah.
keep things safe.
Exactly. Having trained professionals, monitoring your progress, adjusting medications as needed, being there if things take a turn, it's crucial for safety. But here's something that often gets overlooked. It's not just about the physical stuff.
Right. You got to address the mental and emotional aspects of addiction, too.
Absolutely. Our sources really emphasize that. Medical detox isn't just about flushing the substance from your system. It's also about equipping you with the tools and the insights you need for long-term recovery.
So it's like, while you're physically detoxing, they're also starting you on the path of understanding your addiction, learning coping mechanisms.
Yeah, you got it. Therapy, education, these are all integral parts of the process, and they usually start right there during detox.
Interesting. So it's almost like they're prepping you, not just physically, but mentally and emotionally, for the more intensive work that comes after detox.
That's a great way to put it. Detox gets you stable, gets you to a place where you can actually engage in that deeper work of therapy and recovery.
So you're going through this whole process, right? You're getting help, you're getting stable, but how long does it actually take? I feel like there's this misconception that detox is like a week at a fancy spa and then poof, you're cured.
Yeah, I wish it were that simple. But honestly, the length of medical detox, it can be all over the map. It really depends.
Oh, and this is where I get excited. Hit me with those factors.
Yeah.
What influences how long someone's actually got to be in detox?
Okay, well, first off, got to think about the substance itself, right? Each one is different. Some substances hang around in your system longer than others, and they all have their own, withdrawal timeline. Actually, our research had this super interesting table that breaks it all down, like how long detox takes for various drugs and alcohol.
Yeah, that table was kind of wild. Like, I knew alcohol withdrawal could be rough, but I was surprised to learn that some of those symptoms, even the not-so-fun ones like insomnia or anxiety, they can stick around for weeks, even months for some people.
It's true. People don't always realize that. And while we're on the topic of surprises, let's talk about marijuana for a sec.
Okay, yeah, I was going to say that one kind of threw me for a loop.
Most people, when they think about marijuana, they don't immediately jump to oh yeah, severe withdrawal.
I'll admit, I definitely fell into that camp.
But, and this is what our research really brought out, while the physical withdrawal from marijuana is generally not as intense as something like alcohol or opioids, the mental and emotional part, yeah, that can linger.
We're talking mood swings, trouble sleeping, even those cravings coming back full force.
Exactly. And for those who've been heavy users long term, it's not unusual for those effects to last for weeks, some even say months.
Months. Wow. Okay. So marijuana withdrawal It's not just a walk in the park like some people might think.
Not necessarily, which just goes to show everyone's different, right? Detox isn't one size fits all. On top of the substance itself, you got individual factors at play too.
Oh, right, like your metabolism, how your body processes things, all that
Yep.
jazz.
Yep. Your metabolism, your body mass index, overall health, any mental health stuff going on, all that plays a role in how your body gets rid of the substance and how long that detox process actually takes.
Okay, so bringing it back, that initial assessment, that's got to be so important. Really figuring out each person's like starting point.
100%. It's about putting the pieces together, to come up with a game plan that really fits the person. But, and this is key, as important as medical detox is, it's just the first act. There's a whole lot more to the story.
Okay, I'm intrigued. What happens after detox? Where do people go from there?
So we've tackled the physical, getting you stable. Now we got to dig into the why, the psychological and emotional roots of addiction, all that. And that's where rehab comes in.
Ah, so this is where the deeper work begins. Getting to the bottom of things, learning how to stay sober for the long haul. What's the rehab part actually look like after someone's done with detox?
Well, there are basically two main roads you can go down, inpatient or outpatient rehab. Inpatient, that's when you're living at a facility 24/7 for the duration of treatment. It's definitely more immersive. You're totally focused on recovery.
That makes sense, like hitting pause on life
Yeah.
to really dedicate yourself to getting better. So what about outpatient then?
Outpatient's more flexible. You live at home, but you go to therapy sessions, group meetings, all that good stuff on a set schedule. Good option for people who can't just put their lives on hold. Work, family, all that.
So there's a whole spectrum of care, depending on what a person needs in their life. Again, it goes back to that personalized approach we were talking about. But gotta ask, with all this talk about rehab, some people might be thinking, why bother? Can't I just quit on my own, go cold turkey? What would you say to that?
I hear that a lot. And it's tempting, right? Just rip off the Band-Aid. But the truth is, it can be really risky, like actually dangerous, in some cases, even life-threatening.
Especially with some substances more than others, right? Like alcohol withdrawal, that can get scary fast.
You got it. Alcohol is a big one. If it's not managed correctly, you can get into some serious trouble. There's a condition called delirium tremens, DTs for short.
I've heard of that. That's the one where people start hallucinating, right?
Yeah. And seizures, confusion, the whole 9 yards. It can be fatal. No joke.
Definitely not something to mess around with. Okay, so another point for medical supervision. Makes you feel safer knowing there are professionals who know what to look for, how to handle things if they go south. Plus, they can give you medication to make those withdrawal symptoms a little less, well, awful.
Exactly. And that brings us to another important piece of the puzzle, medication-assisted treatment, or MAT.
Okay, let's break that down a bit. What is MAD and how does it work?
Basically, AT is using meds alongside therapy and counseling to treat addiction, especially when it comes to opioids and alcohol. These medications, they interact with your brain chemistry in a way that dials down the cravings, makes withdrawal less intense, and basically helps reset those brain circuits that addiction has kind of thrown out of whack.
So it's like taking the edge off those cravings, that physical misery, so you can actually focus on the mental and emotional work of recovery.
You nailed it. It levels the playing field, gives you a fighting chance, doesn't magically cure everything, but it can be a game changer for a lot of people.
Sounds like a valuable tool. But let's be real for a sec. We've talked about professional help, rehab, meds. This all sounds expensive.
It's true. Cost is a major factor, and it's something to be upfront about. Medical detox, it's specialized care, so yeah, it's not free.
From our research, it seems like the cost of detox can be all over the place. What kinds of things affect the final price tag?
So many things. Like, what kind of facility are we talking? Basic amenities versus luxury rehab, that's going to make a difference. Then there's the length of stay, which we know varies. Plus, any extra services? Do you need treatment for other mental health stuff at the same time? Specialized therapies? It all adds up.
So not exactly a one-size-fits-all answer when it comes to cost. Makes sense. Really important to do your homework, talk to the providers, find something that fits your needs and what you can afford. But before we jump ahead, I do want to say, I hope finances don't stop anyone from getting help if they need it.
Couldn't agree more. There are usually resources out there, ways to make it work, sliding scale fees, payment plans. Some insurance plans even cover some of it. Don't be afraid to reach out, ask questions, explore your options. There's always a way.
Yeah, that's really important to remember. There's always a way, and no one should have to go through this alone. Okay, so big picture, someone's listening to this, thinking about detox. What are the key things they need to walk away with?
Well, I think first and foremost, you got to ditch that idea that detox is a quick fix.
It's a journey, Oli. It's a
It's a
process.
process. You don't just flush it out and boom, good to go. It's the first step, a crucial one, but it takes time.
Prepares you for everything else to come.
Right. And that brings us to number 2. You don't have to go it alone. Seriously, reach out, get professional help. Trying to white-knuckle your way through detox, it's not just hard, it can be dangerous.
Definitely. Those professionals, they've got your back, can keep you safe, make sure everything goes as smoothly as possible.
Exactly. Having that support system makes all of the difference. And last but not least, remember, there's no shame in needing help, and there's no one right way to do this whole recovery thing. It's personal.
Everyone's journey is different.
100%. Find what works for you. Maybe it's medication-assisted treatment, maybe it's therapy, support groups, whatever. Don't be afraid to try different things, until you find what clicks.
So much good stuff to think about. This has been a really eye-opening conversation. But before we wrap up, something's been kind of bugging me, especially after talking about medication-assisted treatment. It's like when you're using medication to help manage addiction, even if it's helping someone stay sober, is it really recovery if they're still relying on that medication long term? It feels kind of ethically murky.
Oh, that's a big one. And honestly, there's no easy answer. It's something people in the addiction and recovery field debate all the time. Some folks are like, nope, recovery means 0 substances, period. End of story. Others say, hey, if medication helps you live a better life, if it keeps you from relapsing, then that's part of recovery too. It's complicated.
Yeah, it really is. Makes you think about what recovery really means, what it looks like for different people.
It sure does. And that's something I hope our listeners will keep thinking about too. What do you believe? What does recovery mean to you?
Such a good question. And on that note, we'll leave you all with that to ponder. Remember, knowledge is power, and the more we understand about addiction and recovery, the better equipped we are to support ourselves and those around us.